Good afternoon or good morning, depending on where you are. My name is Bernie Rubin. I'm a rheumatologist, and I currently work as a medical director for GlaxoSmithKline. What I'd like to do for the next few minutes is answer questions that have frequently been written to Lupus LA and to GSK about COVID, the effects on patients with lupus and other autoimmune diseases, vaccines, monoclonal antibodies, and all of the other types of issues that we frequently have been dealing with for the past 18 months. So let's start out with some general questions, and then I'll handle others that have come in over the past 4 to 5 days. We all know what COVID is, that it's a dangerous viral illness, which was discovered in December of 2019 in Wuhan, China. It's very contagious and has spread quickly around the world. It's primarily a respiratory virus, so that it may feel like the cold or the flu, but it can lead to severe complications. Although many people who have COVID infections have mild symptoms, some people become very ill. And patients who are immunocompromised, for example, such as lupus patients, are much more vulnerable to not only this virus, but other viruses and other illnesses. And they may be at an increased risk for severe illness, specifically from COVID-19. So before we talk about vaccines and other therapies, what are things that you, as someone who has lupus or someone who has a family member or a close friend or companion who has lupus, what can you do to protect yourself from the virus? Well, certainly in consultation with your doctor, we would suggest that you get vaccinated as soon as possible. Obviously, it would be important to wear a mask that covers both your nose and mouth to help protect both yourself and others. Social distancing is a term that we've come to understand, which means that you need to be at least several feet, perhaps 6 feet far apart from others who don't live with you. Avoid crowds and poorly ventilated indoor spaces. Wash your hands often with soap or water, and also use hand sanitizer if soap and water are not available. Make sure you consult with your healthcare provider about continuing the medications that you might be taking for your lupus. Don't delay in getting any emergency care for your lupus if you feel that you're undergoing a flare. Monitor your health. Make sure you take care of your mental health, uh, and check with up-to-date guidelines that may be formulated not only from the Lupus Foundation, but also from the CDC. Now, what I'd like to do is go back and talk specifically about some of the more pertinent questions that the lupus community has interest in. So, an important question that's come in more recently is, do we have any new data about the outcomes of lupus patients who contract COVID-19? So we do have a study that was done in Brazil, relatively small, of 319 individuals who had lupus but were hospitalized, but they're compared to 250,000 or 250,000 patients who were hospitalized with acute respiratory distress syndrome but didn't have lupus. So these are very ill patients. And the study looked at hospitalized patients with lupus and severe lung involvement. And what they noted was that there was an increased risk of death by 74% and an increased risk of poor outcomes from this severe lung involvement by 39%. Compare in the lupus patients compared to the 250,000 patients who were equally ill but did not have lupus. The reasons for this are not entirely known. It could be due to the pathophysiology of lupus or some other factors. Another question has come up is that has there been an increase in inflammatory markers in individuals who get COVID-19? And there was a meta-analysis, which is a combined study that looks at several different research projects. And in this case, it was looking at 83 different studies that were conducted and showed that there were elevated levels of inflammatory markers like C-reactive protein, which is a blood test that is frequently done in people who have SLE, and it showed that their C-reactive protein was elevated. Again, it's not clear how important this fact is. It's not important if this is much different in just the lupus patients or in other individuals. But what it does go to show is the fact that an infection with COVID-19 can be severely inflammatory within the body. Do we know, for example, another question is, do we know about the vaccine efficacy if you're on lupus treatments? And unfortunately, we don't have any data at this time. The American College of Rheumatology has guidance related to the use and timing of vaccination and various immunomodulatory therapies. So therefore, it's very important for you to speak to your healthcare provider about your specific lupus treatment and discuss appropriate timing should you want to take a vaccine or now perhaps get a booster. Another question that's come in is talking about nonsteroidal anti-inflammatory drugs, for example, like ibuprofen or naproxen. And do these nonsteroidal anti-inflammatory drugs make COVID symptoms worse? So currently, the CDC is not aware of any scientific evidence establishing a link between nonsteroidal anti-inflammatory drugs, for example, ibuprofen or naproxen, and worsening of COVID-19. However, the FDA, the World Health Organization, and the CDC are continuing to monitor the situation and will review any new information on the effects of nonsteroidal anti-inflammatory drugs and COVID-19 as it becomes available. However, if you have some minor pain or a headache and you want to take a treatment other than a nonsteroidal anti-inflammatory drug, there certainly are other over-the-counter and also prescription medications which are approved for pain relief and fever reduction. Again, you should check with your healthcare provider if those other treatments would be appropriate for you if you have lupus. Patients with lupus who rely on nonsteroidal anti-inflammatory drugs to treat the chronic conditions may well be able to continue taking them if your physician agrees. Another question that was recently asked is you talked about the risk, increased risk of death and poor outcomes in that Brazilian study. And what are the proactive measures that I could do, uh, hopefully to prevent getting infection? And I mentioned them a few minutes ago, but let me reiterate them because, again, they're very empowering because these are things that you can do for yourself and your loved ones. Get vaccinated, avoid crowded indoor and outdoor spaces, wear a mask covering your nose and your mouth when you go out. Um, Make sure that you wear, if you have to wear a mask, it would be preferable to get an N95. If not, a disposable mask underneath a cloth mask will give you the most protection. Avoid touching your eyes, nose, and mouth. Wash your hands often with hot soapy water for at least 20 seconds. Use alcohol-based gels or wipes at home or in public if you don't have the ability to wash your hands with hot soapy water. Individuals with lupus are also prone to other infections. So a question that came in uh, was, is there a higher risk for lupus patients to get shingles? And what if a patient with lupus is on medicines at the time they're vaccinated, for example, hydroxychloroquine or even a corticosteroid? So based on current evidence, which is unfortunately limited to just case reports and small case series, it's not possible to determine whether COVID 19 increases the risk of shingles. Uh, Many healthcare providers are aware of an possible increased risk of shingles uh, during the pandemic and also in immunocompromised patients. Uh, and therefore, it would be appropriate to talk to your healthcare provider about what either therapeutic or preventative measures might be available to you. There was a recent review that was published that showed several dozen cases of shingles following COVID-19 infection. And again, the number may be much greater. This was just what was reported in that one publication. The next question that comes in is, when should lupus patients get booster shots? Well, the CDC recommends that people who are moderately to severely immunocompromised should receive an additional dose of an mRNA COVID-19 vaccine after their initial 2 doses. People who have compromised immune systems may benefit from an additional dose to make sure that they have enough protection against COVID-19. Who qualifies as being immunocompromised? If you have cancer and you're on therapy for it, both either a solid tumor or a cancer of the blood system. If you had an organ transplant and you're taking medications to suppress your immune system so that you don't reject the transplant. If a patient has received a stem cell transplant within the last 2 years, again, or taking medicines that would suppress their immune system. If you have a moderate to severe primary immunodeficiency syndrome, for which there are specific names and descriptions. If you have advanced or untreated HIV infection. And then lastly, if you're undergoing any active treatment with high dose corticosteroids or any other medicine that might suppress your immune response. It's important to make sure you talk to your healthcare provider about your lupus and also about the medications you're taking and whether getting a booster is appropriate for you. The CDC recommends that people who have moderate to severe compromised immune systems, which includes many individuals who have the disease of lupus, whether they are on certain medications or not, the CDC would then recommend that you receive an additional dose of an mRNA COVID-19 vaccine at least 28 days after the second dose of either the Pfizer vaccine or the Moderna vaccine. Another question that's come in, if I had a flare after I got my vaccination, what would I expect and what would be the plan for me to receive a booster? So the American College of Rheumatology guidance states that while vaccination, either primary or supplemental, would ideally occur in the setting of well-controlled disease, except obviously for patients who have life-threatening illness and there is no way to wait, that a COVID vaccination should occur as soon as possible for those people in whom it's recommended. And this would be irrespective of their disease activity and severity. So again, it's important to talk to your personal physician or healthcare provider about the timing of a booster after you've had a flare of your lupus, or if you had a flare following a previous vaccination. There is an international online survey of almost 3,000 people who had systemic rheumatic disease, and they all received COVID-19 vaccinations of one type or another. And this large survey that was done online allowed these 3,000 patients to self-report the types of reactions that they had. And in this survey, those individuals with rheumatic disease flares that required a change in the treatment of their disease was less than 5%. On the other hand, any flare that was defined as an exacerbation of symptoms, my symptoms got worse, or new symptoms that seemed to be related to my lupus or other rheumatic disease. So that was 13.4%. So let me just restate that one more time. In an online international survey of about 3,000 individuals, when they were asked, you took your vaccination, did you feel bad afterwards? Did you have a flare of your disease in any way, shape, or form? That was about 13.4%. On the other hand, that reaction you had to the vaccination, did it require you to change your medications at all? Either requiring you to change what you're already taking, take more of something, a different medication. So that was less than 5%. Another question that's come in is, what are the best treatments out there for COVID-19 infections in lupus patients? Well, if you test positive for COVID-19 and you now have the ability to not only do in-home testing and also go to testing sites, but if you test positive or if you have symptoms, talk to your doctor right away and then ask At this point in time, given what my disease is like, given what medicines I'm taking, and given how soon I might have gotten infected, where I am in course of the disease, what kinds of treatments are available to me? So for people who are at high risk of disease progression, the FDA has issued an emergency use authorization, so-called EUA, for a number of investigational monoclonal antibodies that can attach to parts of the virus. Your healthcare provider will know and will help you to decide whether this type of investigational treatment might be appropriate for you to treat your illness. If you're diagnosed, what's the first thing that you should do and talk about with your doctor? And do you recommend having a treatment plan in place with your doctor or your rheumatologist should you have a positive test? Well, importantly, if you test positive for COVID-19 and you have symptoms, it's important to talk to your doctor right away because many of the treatments depend on timing of how long you've potentially had an infection. So you must ask your doctor what treatment is best for you at this stage, potentially in your illness. In the meantime, you should isolate yourself and call your doctor, as I've mentioned several times. And your doctor may recommend supportive care, such as medicines to reduce your fever, tell you to stay hydrated, get plenty of rest. It's important if you feel ill but you haven't been tested to get tested. And again, hopefully, with one of the tests that you can get results either within several minutes or hopefully within just a few days. And then monitor your symptoms while you're awaiting the results of the test and also trying to decide what your next step should be. For people that are at high risk of disease progression, as I've said, the FDA has issued the EUA for these monoclonal antibodies, which are investigational, and they may be helpful for you depending on your given situation, but you have to talk to your healthcare provider to understand whether or not that's the case for you. And then finally, a few more last questions. So are vaccinated lupus patients more likely to get COVID-19, or is their protection the same as the general population? So a small multi-ethnic racial study of about 90 lupus patients and 20 healthy controls was done. And in this small study, um, the lupus patients about 29% of lupus patients had a lower response to the COVID-19 vaccine, and that was associated with being on immunosuppression. Uh, and 11.4% of these same individuals had a post-vaccination flare of their lupus. So I had told you about a previous study where a little over 13% of people with rheumatic diseases reported a flare or worsening of their symptoms after vaccination. In this study, specifically of lupus patients, uh, although a small number, 11.4% of lupus patients had a post-vaccination flare. But again, in this small study, importantly, almost a third of the lupus patients had a lower response when they were checked for post-vaccination antibodies compared to the normal population. Certainly more data is needed to assess the efficacy in the setting of patients like lupus patients who are on immunosuppressants, and the need, whether or not the booster is indicated and helpful, and will be providing the additional protection that we all hope they will. Is there one vaccine that's better than any other if you have lupus and you want to get vaccinated? So based on the data for the mRNA COVID-19 vaccines, of which we have 2 available in the United States, there's no preference for one over the other. And therefore, autoimmune and inflammatory rheumatic disease patients should receive either of those 2 that's available to them. Another question that's come up about the monoclonal antibodies is, can I take a monoclonal antibody if I've already been vaccinated, but now I test positive months later? So the NIH guidelines identify that you can get a monoclonal antibody if you test positive for COVID-19, even if you've been vaccinated in the past. However, as I've said over and over today, it's very important for you to check with your local physician or your rheumatologist to ensure that you have a clear understanding of your individual circumstances and how that may play in to your decision making. Have lupus patients been in the studies of these monoclonal antibodies? So unfortunately, immunocompromised patients were excluded from the GSK and VIR monoclonal antibody studies. Immunocompromised patients have limited representation in many of the clinical trials. Many experts strongly recommend therapies for patients with these conditions, as they're considered, because of your underlying disease and the drugs that you may be taking, you're considered risk factor for progression to severe COVID-19 infection. And then, what's new? Are there any clinical trials for patients with autoimmune disease and vaccination? So the NIH has begun a phase 2 trial to assess the antibody response to an extra dose of an authorized or approved COVID-19 vaccine in people with autoimmune disease who didn't respond to their original vaccine regimen. This trial will also investigate whether pausing immunosuppressive therapy for autoimmune disease improves your antibody response to the extra dose or booster of a COVID-19 vaccine. The trial is called the COVID-19 Booster Vaccine in Autoimmune Disease Non-Responders. Initially, it will include people with 1 of 5 autoimmune diseases: multiple sclerosis, pemphigus, which is an autoimmune skin disease, rheumatoid arthritis, systemic lupus erythematosus, or scleroderma. People in the study must have had a negative or suboptimal antibody response to 2 doses of either the Moderna vaccine or 2 doses of the Pfizer vaccine, or to 1 dose of the Johnson & Johnson vaccine. And everyone should have received these vaccines prior to enrollment. All people enrolled in the study also should be taking an immunosuppressive therapy, and there are a variety that would be allowed. And all participants will receive an extra dose of the same COVID-19 vaccine that they originally received. So if you had 2 doses of Pfizer, you get a 3rd Pfizer booster. If you had 2 doses of Moderna, you get a Moderna booster. If you had a single dose of the Johnson & Johnson vaccine, you'll get a Johnson & Johnson booster. The main goal of the trial is to determine the proportion of individuals who have a significantly better antibody response 4 weeks after receiving the extra vaccine booster dose than they did after their original vaccinations. This trial is going to be ongoing, and people who are enrolled will be followed for a total of 13 months. So results should be in approximately 1 year. And then the last few questions are about what happens after I've had my vaccine. So will the COVID vaccine cause a flare of my lupus? And as I said earlier, we do have that data from that large online study of about 3,000 individuals. Now, not all these people had lupus, they had other rheumatic diseases. But what they noted in that study was a little over 13% of the individuals self-reported that they had a flare of their underlying rheumatic disease after vaccine, but less than 5% had such a change in their symptoms that it required a change in their therapy. And then the final question is regarding post-exposure prophylaxis. So the FDA has issued an emergency use authorization of monoclonal antibodies for post-exposure prophylaxis. So who would be indicative of this type of an individual? So these are folks who are at high risk for progression to severe COVID-19, including hospitalization or death, and they're not fully vaccinated, or they're not expected to get an adequate immune response to a complete SARS-CoV-2 vaccine regimen. For example, it could be someone with lupus who has an immunocompromised disease and they're on immunosuppressive medications. In addition, you would have been exposed to somebody who's infected, or you are at high risk for exposure to somebody who either is infected or could be. For example, the patient was somebody in prison, the patient was living in a nursing home, the patient interacted with those kinds of people frequently. So the CDC defines close contact as somebody who's been within 6 feet of an infected person, and that person has a laboratory confirmed or a clinically significant illness which is consistent with COVID-19 for a cumulative total of only 15 minutes or more over a 24-hour period. So that means if you have lupus and you're on immunosuppressive medications and you have spent only a 15-minute time period within 24 hours with somebody who has known SARS-CoV-2 infection because they've been tested positive or they have severe symptoms, then you might be considered at risk for developing progression to severe COVID-19. And therefore, according to the FDA, you may well be appropriate to receive a monoclonal antibody because of post-exposure risk, and you would warrant prophylaxis. Again, what's most important is that you specifically would talk to your healthcare provider or your rheumatologist or your physician to see whether or not in your specific instance this type of a treatment would be warranted. Well, I want to thank you all very much for listening. I hope that the information that I've provided has been helpful. As you well understand, information is coming out literally every 24 to 48 hours. So the information is relevant now, but clearly could change in the near future. And I would urge you to stay up to date by speaking to your healthcare providers, by making sure that you keep accessing sites like this excellent Lupus LA Facebook page, because there will be more information forthcoming over the next days and weeks. Thank you again.